Morning, everybody, and thank you for joining. We are all together here from around the state due to a testing crisis that is taking place right now in New York. Also, to a certain extent, we're seeing it nationally. We are concerned about our constituents from all across this state who are contacting all of us, very frustrated and angry with real concerns related to testing in their areas. We are calling on Governor Kathy Hochul and the state of New York to fix this, to focus more on it. The Omicron variant was something that was very foreseeable all throughout the planet. We saw it in November, where the entire world was watching what was happening in South Africa. Fortunately, what we've seen is that while the Omicron variant is contagious, it's also causing much milder reactions. So as far as our message to New Yorkers as it relates to the variant, it's one of encouraging calm. However, for Governor Kathy Hochul and her administration, we really need to light a fire under her and under all of them because this has been utter incompetence. While we have seen it spread now, the Omicron variant all around the world, New York State, New York City especially, has been an epicenter. There have been inconsistencies throughout the state, which unfortunately is the only constant of Governor Hochul's approach towards combating COVID, has been a constant of being consistently inconsistent. And that's one of the areas that we're going to seek to address during this morning's press conference. As well as the issues related to New York State, we want to draw attention to the federal government's role here. This was something that was foreseeable, not just for the state of New York, but really foreseeable for our entire nation. And to be caught this off guard, leading to our constituents around the state to have this frustration and their anger when it was this avoidable is greatly concerning for those who are in charge who, in many respects, have been focused on firings, fines, threats, mandates. They have really focused, you would say, maybe obsessed over that approach. They've run out of ideas. So instead of talking about what we're here to talk about this morning, their new announcement each day, in many respects, has been focused on what new mandate, policy, or lockdown, or fine, or threat, or firing could be imposed. Where really what we should have been doing is all levels of government, all parties working together, focused on ideas. And this group you'll hear from this morning come to the table armed not just with our constituents' frustrations, but also with ideas to be able to fix this. One of the issues that I've heard many people from around the state talking about, the confusion related to the testing sites and the testing hours not being the same. For example, in central New York, you have testing available 4 days a week for 6 hours, but in the Finger Lakes, you have testing available for 6 days a week for 9 hours. If I was the governor right now, I'd be calling for uniform testing hours all across the state, which will help ensure New Yorkers know exactly what they're getting when they're choosing to go to one of these sites. It is important, and we are calling on the state to adopt uniform testing hours as opposed to the varying times that we're seeing from one region to the next. Additionally, we need to expand testing hours. Going back to that central New York testing site, it's only open for 4 days a week for 6 hours a day each. 3 of those days are during prime business hours. So not just consistency with regards to New Yorkers knowing when the testing sites are going to be open, but we're also calling on the hours to be expanded as well. Overall, New York is estimated to have a budget surplus of over $4 billion this year. Instead of spending hard-earned tax dollars on, for example, multiple $1 billion going to people who aren't even legally in the country, We should be pouring money into acquiring and distributing the tests we need to ensure New Yorkers have access to readily available, efficient testing. Investing the New York State hard-earned tax dollars in hardworking New Yorkers who need that responsiveness from Albany is key. And unfortunately, what we're seeing is billions of dollars spent prioritized towards people who aren't even legally in the country. So we need the priorities to be set correctly. Additionally, we've heard a lot about hospital capacity over the last few weeks. By firing our healthcare workers and turning heroes into zeros, Kathy Hochul exacerbated what was already a dire staffing issue here in our state. With expanding testing capabilities, these healthcare workers should have testing options available to them. So these healthcare workers who have been fired should be given an opportunity here to help, because what we're hearing in the news, we're hearing reports of, are sites that people have appointments, and then they learn as they wake up in the morning that that site is closed. That site then provides an announcement saying that they are unable to staff their location. But meanwhile, we have healthcare workers inside of this state who are able to assist. But the governor is saying no. And it doesn't make any sense if you are following the science, if you're following facts, data, truth. We need these testing sites to be open, and you can have a testing option for these individuals who are utilizing PPE to be able to assist with testing, as opposed to seeing these sites closed spontaneously all throughout the state. For months, we have heard from physicians and medical professionals about the need for more COVID test manufacturing. And on top of the foreseeable rise in the spread of COVID over the course of these last few weeks, this is something that we shouldn't even have to be here on December 30th trying to play catch up with. Now, some are spinning it and saying that they didn't see it coming. And as the president of the United States himself has said, we just would want to point back to not only South Africa telling the world what they were experiencing with the spread of Omicron. This was a point being discussed at the White House press briefing room with the White House press secretary weeks ago. So the idea that all of a sudden in the last week or two, this country and our state was blindsided is divorced from the reality that was playing out before our very eyes. It was, in fact, the United States of America, our country, talking about a testing ban, that a travel ban, that this is a conversation from the end of November. So our country clearly acknowledged that this was an issue coming out of South Africa that we should have been paying attention to early enough. There has clearly been a rise in testing demands, hundreds of % increase in the amount of tests that have been asked for. The president has now acknowledged that he fell short when it comes to testing and that we need to do better. With that, we certainly strongly agree. Now, earlier this year, the president diverted $850 million that was allocated towards expanding the national stockpile of COVID tests. That's completely unacceptable as well. That diversion of funding from earlier this year, appropriated by Congress, is inexcusable, especially when you fast forward to the end of the year, we have this surge and not enough testing capability. This morning, we're joined by elected officials from all across the state, from Long Island to New York City to Buffalo and elsewhere, to hear about this testing crisis firsthand, how it's affecting people in the communities that they represent. And just to give you a few brief examples as far as long wait times, there have been reports out of Staten Island of a 4-hour wait time. We have Councilman Joe Borelli here on the line. In Brooklyn, 2-hour wait time. Manhattan, 4.5-hour wait times we're hearing of. Long Island clinics closing 4 hours early because of the people already in line. Nassau, 3 hours. Onondaga, people started to line up to receive at-home kits at 6:30 a.m. for a 9 a.m. county-run event, and the county ran out of kits in 20 minutes. Yesterday I was speaking to somebody from Buffalo, and we're about to hear from the Republican leader, Rob Ort. People are complaining about the long lines of cars, one at the Western New York rapid testing site on Transit Road. We've heard stories out of Clinton. Pharmacies that do the testing require an appointment, and all appointments are booked for the entire week. The only sites that take walk-ins are the health department, but they only take people without insurance or a primary care physician. One site requiring a doctor's note. We're hearing stories about canceled appointments, also from Staten Island. One Staten Islander told the Advance, SILive.com, that her parents showed up at the Central Family Life Center having made an appointment for 10:10 a.m., only to be turned away because the location hadn't received the supplies yet. There's also been a lot of confusion. One resident of New York City regarding a city-run van testing site said, quote, "I feel like they're taking a long time because of the screening and registering, and they're not making it very clear." We're hearing a lot of reports of confusion, not just amongst New Yorkers, but also of the people who are running these sites. And of course, we're hearing about the running out of tests. City MD in New Dorp, they stopped testing residents around 10 a.m., telling people they ran out of tests for the day and advised people to come back the following day. That's reported by residents. In Long Island, City MD in Levittown closed down 4 hours early from the amount of people in line. In Suffolk County, Heckscher State Park's Field 8 testing site in East Islip closed after 1 hour because they had reached capacity. Earlier, I referenced how you've had locations closing down due to the staffing shortages. That's come out of widely reported within New York City. City MD locations have been closing throughout the city due to staffing shortages. De Blasio closed 20 New York City run clinics in November. So these are just some of the many examples of what we're hearing from constituents all throughout the state. Looking forward to hearing from each of our elected officials who are on the line with us. We're going to start off with the New York State Republican leader, Rob Ort. And at the end of today's presser, we'll be happy to answer any questions from members of the media on the line. Thank you to all media for participating in today's press conference from around the state. And again, we're coming here not just to call on Governor Hochul to step up, because in so many respects, New York has fallen short. We're also coming to the table here today with several specific ideas on ways to address this. This isn't some session to just air the grievances of our constituents, although on behalf of our constituents, we certainly have many grievances to air. There are also many things that should be getting done that aren't right now. Without any further ado, New York State Republican leader Rob Ort.
Thank you very much, Congressman. Good to be with you, and good to be with my other colleagues from across New York State and New York State government. I want to, hit on 3 points that the Congressman touched on a little bit, a little more specifically, as it relates both to my district and my experience and the experience of my constituents. So one is that making testing widely available, and the fact that we have not been able to do that here in New York. We have not been able to do that, and we are 2 years into this pandemic. This is not new. It's almost hard for me to believe that here we are at this point in the pandemic, and we still are talking about a lack of available testing or a lack of accessible testing for New Yorkers. At the same time that you've had an administration that has very much focused on firing people if you're not getting the vaccine, forcing people to choose between their jobs and their health choices, forcing businesses to play vaccine police, when you could spend that same amount of time, as many counties across New York State have, as many counties that I represent, and some of us on this call represent, they've decided to focus on educating, on making testing available. A county that I represent, where I live, Niagara County, has requested on numerous occasions of the governor to return a testing site to Niagara Community College. It was a testing site at one point back in 2020 for several months. It worked. Many constituents that I represent got their tests there. It has not been a testing site now for the better part of all of 2021. And in spite of the fact that our local county government, myself, Assemblyman Angelo Morinello, and Assemblymember Mike Norris have requested that to be returned to a testing site so that folks in Niagara County and in Erie County can go and get a COVID test if they so choose at that site. We already know it works. It already did work. The idea that we're not opening that back up as a testing facility or as a testing location, I have not heard a good reason from the governor or her administration as to why. What they have talked about is $65 million to go and levy fines and punish businesses for violations. Businesses, the same businesses, restaurants in the hospitality industry that have been hammered by this pandemic already. And now you're going to go after them with $65 million. Why not take that $65 million and use it to purchase tests, to increase testing capacity, to increase workers to work at these sites so they can get through more people in a shorter amount of time. You heard about the congressman's idea of uniform testing hours, which would also make sense. So people don't have to wonder, do I have to drive over here to get a test today? Or can I go, at a site that's closer to me? So it really is about priorities. It is about a focus. The state of New York, since this pandemic has started, has been far more focused on lockdowns. It has been far more focused on punishing and threats and creating an atmosphere of fear, which of course the answer then is, what can the government do to stop this? There's a different way to go about it. Other states have done it, and you've seen the results in both their economic numbers, but also you've seen no tangible difference in deaths. In fact, in some instances, you've seen states that haven't gone the way New York has, that have had better outcomes and better results when it comes to the actual health outcomes of this pandemic. And I think that's what we want to focus on today, and what Congressman Zeldin is focusing on. We need to make testing widely available. There's no reason it can't be. And to prove that point, just the other day, yesterday, as a matter of fact, I received 4 at-home test kits mailed to me by the New York State Senate, the Senate Majority, the Secretary of the Senate's office. 4 test kits that I received, and I know all of my members, and I suspect every senator received. Now, I didn't pay for these. These were obviously purchased by taxpayer dollars and mailed out to every elected official. My question would be, if that could be done for elected officials, why isn't it being done for the public? Why would it not be done for constituents, to make those same tests available for people who would need to take those tests or who would feel compelled to take those tests? The other day, I went and stood in line in my car at a testing location. I didn't wait hours, thankfully. I waited about 15 minutes. But I had to get out of my house, get in my car. I didn't feel well, and go get a test. Thankfully, it was negative. But many of my constituents don't have that option, or they have 3 kids at home, and dad's working or they're working, and it's very difficult to make this happen. So those at-home test kits would be wonderful. I went online looking for those at-home test kits, and you can't find them. They're all sold out. When a store does get them in, they're gone within hours. So whatever the intentions were, and noble they may have been, I'm not going to accept at-home test kits at a time when my constituents can't get them. I think that the hypocrisy is hard to miss. The optics are terrible. And it's a reminder of why people don't trust government, why they hate politics, because of stuff like this. And so, I'll be donating those test kits and any other kits that I get. I'll be making those available to my county health departments where I represent. I know they will put those to good use to people who need them. But the fact remains But if we're able to do that for elected officials, clearly we can do it for our constituents. And again, I think taking that $65 million the governor set aside for enforcement of her mandate, I think would be better used to purchase testing, to make testing more available, to educate people on why they should go and get a test if they're feeling under the weather, and educate people on the resources and ag services that are out there so they can make responsible decisions on their own, just like they've always done and we've always expected people to do, to keep people safe. And I think that would be a far better use of public dollars. I think it would be far better received by the public in general. And I think it would change the course that New York has been on, which has been either a lockdown, hard lockdown, or a soft lockdown at any point in this pandemic. And again, it's creating that culture of fear. And as the congressman said, there's no need for fear. What we know about Omicron should be, we should be cautious, but we should be calm, and we should be able to go about our lives, whether it's kids in school, people going to work, or whatever it might be during this point. But to not have testing available to the public, to be making testing available to the elected class, and to be focused all of our dollars on punishing small business, I think is the wrong way to go. And so hopefully the governor and others will heed what we're saying today and make those changes as we go forward here. But I know the elected leaders on this call will continue to advocate for the things that we're talking about here today. So Congressman, thank you for having me.
Thank you, Leader Ort, and your story, your experience of getting those kits sent to you remind me of what happened earlier in this pandemic. One of the scandals plaguing the Cuomo-Hochul administration was the COVID testing priority placed to family and friends of the administration. They used state health department officials to test at private residents, and they were moving those samples to the front of the line. We have seen this at different levels of government leadership, and you know this as a military veteran yourself, is not to eat first, you eat last. And unfortunately, there are some in government who think that you should be receiving the first at-home tests as opposed to your constituents. And I appreciate you weighing in with your instincts on that, which I believe are correct. At this time, I'd like to call on New York City Council Minority Leader Joe Borelli.
Thank you, Congressman. And I think I speak for all of us when I say that when you take over this state, we'll be in a much better place than we are now. Because I want to start in sort of the 40,000 foot mode and look at the data points that our state is seeing right now. Right now, we lead the nation in failure. We are the #1 case rate state in the entire United States of America. We almost lead parts of the world in COVID case rates per 100,000 residents. And the states that are right after us are New Jersey, who mimicked us in almost every facet of the pandemic, and California, who actually went further on some mandates. The point I'm trying to make is that the mandate and punish model, which was so prevalent in the Cuomo and now Hochul administration, has failed. And I'm asking the members of the media that are looking at us right now, who are on this list, to start being honest and ask those tough questions to our elected leaders about why their system of dealing with and coping with the pandemic has been consistently wrong. The consistency from the Hochul administration is that they have been consistently wrong. Again, we have the data points to show that. And we have the data points to show that other states that focused on testing and ramping up testing at critical points, focused on treatments and having the wide availability of treatment options for different residents, for protecting nursing home residents, as opposed to protecting, as the congressman pointed out, their protected friends and allies in the administration. Those states are doing a better job than us. And to get hyper local, yeah, we're seeing the 4-hour lines. Yeah, we're seeing the 5-hour lines in other places. Yeah, we're getting told we can't get more testing sites here, we can't get more testing sites there. It's a problem, but it's a problem that was foreseeable. As Congressman Zeldin pointed out, we had the test case. We had Omicron in South Africa. We knew New York is a port of entry for so many people around the world. We knew this was coming. We knew it was coming because our elected leaders actually said, hey guys, this is coming. Thankfully, it's not as deadly as previous variants, but the fact that Omicron is here was not a surprise. For 4 years, I've had oversight over our city's Office of Emergency Management. And we have contracts with tow truck companies. We have contracts with plowing companies, tree removal companies, ambulance services, which we actually activated in the beginning of the pandemic. All these kinds of organizations are on contract with us so that at a moment's notice, we can ramp up emergency services at a time they're needed. The fact that our city and our state didn't have testing options widely available when the horizon of Omicron was weeks away, days away, why we're in the back seat right now of a car being led by people who continue. The mayor right now is announcing the continuation of mandates that haven't worked, rather than talking about the testing options that he wants to do. So if you want the local angle for New York City residents, it's that our city has fundamentally failed in providing testing options for people, not just in my neighborhood, but in every neighborhood. Again, the consistency is the consistent failure. No matter where you go in this neighborhood, no matter the demographics of the neighborhood, no matter the wealth of the neighborhood, we're seeing the inability for New Yorkers to get tested and the inability for New Yorkers to get adequate treatment, because so many of the treatments involve and require the diagnosis of a PCR test. So this failure actually has very serious consequences for people, especially with comorbidities, who not only can't get a test in a timely fashion, but can't even get the results because there's such a backlog. So with that, I want to hand it back to Congressman Zeldin and just echo all the points that he and Leader Ort have made.
Thank you to Councilman Borelli for participating today and for your leadership and your advocacy on behalf of not just your constituents, but many other concerned New York City residents who have been airing their frustrations to you. Our next speaker is New York State Senator Peter Oberacker.
Thank you, Congressman, and thank you all for taking time, out of our very busy day to address this important issue. Just to give you some quick background, my district is very rural. It's a huge Senate district. I equated it to when the vaccines were starting to come out as a vaccine desert. We didn't have points of distribution within my district. Take into account the very rural topography of my district, and for me, just to come and get groceries, it's a 18-minute one-way drive. To come into what we call an area where I can get my groceries and things of that nature. So compound the lack of testing sites, traveling 30 minutes, 40 minutes is not out of the question in my district. And then to get to a testing site that either is closed, again, has run out of test kits and so on, just compounds the frustration and does not put us as the government in good light. I made a suggestion back when we were talking about early on distributing of the vaccines. One of the areas I think we could learn with is literally going to our fast food restaurant chains. I mean, who better when they roll a new product out? It is almost seamless. I mean, and we need to ask them, how can they do this and do it so successfully, right? And we as a government cannot. So that would be my first suggestion. Number two, very, very quickly and easily, product needs to go through our county emergency services. From there, the tentacles come out, and distribution sites can be at every local fire department or I can't think of a better place to distribute these than a fire department. Everybody in the community knows where the fire departments are. I'm a member of my local fire department and EMS squad. Who better to distribute, to talk to convey the correct way to test and those type of issues than to do it at that local level. It's an easy, it's a quick response to this huge issue of lack of testing. And lastly, as Leader Ort so put it so well, I too had received my testing kits, and I'm going to follow Leader Ort's example, and I as well be giving those to my local county health department for use there where it will do the most good. Congressman, thank you for getting us together. You're going to hear my colleagues here expand upon other points. I think I've made mine. And again, thank you for the opportunity, and wishing you and everyone here a happy and healthy 2022. Thank you.
Thank you so much, Senator. At this time, we're going to hear from Assemblyman Colin Schmidt.
Thank you, Congressman, for bringing us together and your leadership as we go through almost 2 years now of the COVID-19 pandemic. In the Hudson Valley, I represent parts of Orange and Rockland counties in the 99th Assembly District. We had a National Guard testing center that was stood up right at the beginning of the pandemic on State Parkland, Anthony Wayne Recreation Area. There's been calls, bipartisan calls, to re-stand up that facility. We had the ability to do it. It worked for months and months and months with no issues. The county, local, and state leaders have all come together and said, just restart this back up. We have the National Guard personnel who are ready to do it. It's easily accessible for anyone in the Mid-Hudson Valley region, and really anyone from across the state who's traveling through. This is a major thoroughfare area near Bear Mountain State Park. There's just really no excuse why that hasn't been stood up already. There are also numerous other sites across the Hudson Valley that previously served as testing facilities or could easily take the place of other state-run testing facilities and be stood up at a moment's notice. We have our National Guard and other state resources who have done this, who did this for months. This is just really like turning on a light switch to roll this stuff out. Should take a couple hours, no more than a couple days, since it's a proven model to work and help really alleviate the burden that a lot of our local pharmacists and some of our local testing options that might be privately run are facing, because they only have so much capacity and they're being overwhelmed. Secondly, New York, unlike other states, still has a lot of regulation when it comes to the testing process. We actually have a private testing provider who wants to stand up full PCR testing in my district, but is stymied by state regulation regarding the NPI number and some other regulations. Other states have done blanket relief on this or provided workarounds. And my staff and I have been working since before Christmas to try to get this fixed with the state. And sadly, the Department of Health, we have not been able to solve this measure. Other states have solved this, including with your orders from the Department of Health. There's no reason why we should have private providers willing to put up pop-up testing facilities that would be open to anyone who's able to show up or anyone who's able to make an appointment. And they're facing this continued overregulation in the state of New York. And as been mentioned by some of the previous panelists, we have amazing therapeutics and treatments that are available. But New York State, and as you mentioned earlier, Congressman, the federal government has really been standing in the way, particularly of the antibody treatment for COVID, which saves lives, which will get people back to work, back on the feet quicker, prevent or limit hospitalizations. We've seen other states who have been very successful in using the antibody treatment and making it as widely available as possible. We need to have it as widely available as possible in New York State. We should be setting up state facilities where people can just walk in and get the antibody treatment. At the federal level, we should have, the federal government should, and President Biden needs to invoke the Defense Production Act so that we can get as much of this antibody treatment as possible to every state as possible. And just last week, as these cases ticked up, New York State Department of Health issued more rigorous restrictions on the use of antibody treatments for people. Just at a time where we need to have more access to antibody treatments, our state is limiting that access and making it more difficult for providers to give out this, most likely, in many cases, life-saving treatment for many people. So I join with you in all of your requests, Congressman. We need the state to reopen our state testing facility here in the Hudson Valley at Anthony Wayne. We need the state and the Department of Health to reduce or eliminate the overregulation so that private providers can more easily put together pop-up testing facilities across the state and have a process for those providers, if they have questions or they need to get through some of this red tape, for them to easily do it so they can be on the ground. And when it comes to the antibody treatment, it needs to be as accessible as possible. We should have also state-run facilities that provide that and remove the restrictions on our providers to give this life-saving treatment to as many people as possible. And President Biden needs to do his job and ensure we have as much supply as possible of that treatment. Thank you.
Thank you, Assemblyman. Thank you for sharing your ideas. Our next speaker is Assemblyman Jody Giglio.
Good morning, Congressman Zeldin, and to my colleagues, and thank you for having this very important press conference today. We've learned a lot since this pandemic started, and one thing that we've learned is that mandatory vaccinations is not preventing the virus from spreading, but testing and finding out who has it and making sure that these people stay away from the people so that it's not spread as quickly as it is. And the tests just have not been available. And listening to my constituents saying when they visit New York City, and there's testing sites on every corner. And to just find out on Friday before Christmas through a press conference from the governor's office that they were going to be opening up 2 facilities here in Long Island at Heckscher and then also at IBEW 25 in Hauppauge was enlightening. But then to find out that it was happening next week, no one knew exactly when the start date was going to be. And I'm thankful to my brothers in Union in Local 25 IBEW that their testing site is open. They gave 600 tests yesterday. They've been open since 8 o'clock this morning until 6 o'clock tonight, and there is no line. You can walk in. So the fact that the message has not gotten out there that this facility is even available for people to go test, and we have people waiting in line at Heckscher Park to be tested and then waiting 20 minutes for the results just so they can go to work to get this economy kicking up again, where we've been stifled for many years. As I said, we've learned a lot since the beginning of the pandemic when we fell short on intubators when people were being hospitalized. Now we know that testing is most important, and preparation and planning for holiday seasons when people are coming back to New York and to visit their residents or their loved ones and their family members in nursing homes, only to find out that they couldn't get tested anywhere in order to access their loved ones is poor planning, to say the least, and really not being prepared. So we're focusing so much on mandatory vaccinations where, again, we've said that the mandatory vaccinations, they're working to help the symptoms not be as severe as they were in the very beginning. But the testing is most important. And I'm hearing even from our volunteer ambulance workers and our volunteer firefighters that the concern of testing is better than the mandatory vaccinations, because we're going to lose a lot of volunteer firefighters and a lot of ambulance workers once the mandatory vaccinations come out, and testing is most important. And we need to make those tests available, not only to our emergency workers and our first responders, but to our residents. And it's just been lacking on Long Island. So Congressman, again, I want to thank you. You know, our businesses are struggling. They need their workers to get back to work. We have this new mask mandate now where they're saying, how do we enforce it? If someone says, no, I'm not putting on a mask, I'm tired of wearing a mask. You have people that have tested positive for COVID that can't get a vaccination for 90 days, and they will test positive for 90 days. You have these home test kits that you don't know who's taking the home test kit in order for them to go to work. We need to really vamp up this process, and we need to do it collaboratively with the elected legislators throughout New York State, not with one governor and one health commissioner making the decisions for us and for our constituents. So again, thank you, Congressman Zeldin, for having this today. And hopefully the message will get out there that not only do we need more testing, but we need processes in place to make sense so that we can get people back to work. Thank you.
Thank you, Assemblywoman. And before we get to our question and answers, I'm going to bring on Assemblyman Jared Gandolfo as our final speaker.
Thank you, Congressman. Back to your point of the wait times for testing. I spent yesterday on the phone with a lot of constituents. One was a volunteer firefighter who showed up at Heckscher Park for a test. He got there an hour before they opened. He had to wait more than 4 hours to get his test, just so he knows if he can respond if there's a call that night or in the near future. So this whole process, we should have seen it coming. The governor's Omicron state of emergency it took effect on December 3rd. And here we are 4 weeks later, and we're just now getting these state-run testing sites up and running, and there's no testing capacity. So what I want to know is what was done over the last 4 weeks since the state of emergency took effect to prepare for this winter surge. We all knew it was coming. The governor knew it was coming if she declared the state of emergency. So why are we here? Last night, just to check, I went on the portal to make a testing appointment at the IBEW site in Hauppauge. I couldn't get an appointment until January 10th. It's really just a disaster. People are confused. They need these tests to go to work. They want these tests to go see their family. And the governor if you look at the governor's Twitter feed, she's pushing testing, but there's nowhere to get tested. And to Senator Ort's point, you have that $65 million that's being set aside to enforce a mandate when that could have been used to purchase testing supplies and distributed to, to New Yorkers. So this has to be the top priority right now. You can't have people driving all over Long Island and waiting hours and hours just trying to get tested so they could go to work. People have families they have to take care of. They have to arrange for childcare to do this. It's just such an inconvenience for everyday New Yorkers, and it has to get fixed immediately. There's no excuse.
Thank you so much, Assemblyman. And at this time, if any members of the media have any questions, you can raise your hand. You can type your question into the chat feature.
We have our first question in from Ashley at WAMC. This is for Congressman Zeldin. You criticize the funding from Congress as, quote, inexcusable, yet are also criticizing the lack of availability of COVID tests. If not pushing an unfunded mandate onto localities and municipalities or spending the cost with state funds that were not included in the budget agreement under Cuomo, then how should the state pay for and provide these tests to residents? And what would you do differently from what Hochul is doing now to be able to provide these tests immediately?
Well, thank you for the question. What I criticized as inexcusable was that earlier this year, the Biden administration diverted $850 million away from funding that was allocated towards COVID preparation. That was one of multiple pots of money where there was funding allocated specifically for testing that was getting diverted to a non-testing purpose. And that's what I was referencing earlier as inexcusable. With regards to how the state should pay for the testing, as I referenced earlier in my remarks, the state has been talking about how it has a multi-billion-dollar budget surplus. And I also referenced the multi-billion-dollar fund that was created earlier this year it was called the Excluded Workers Fund for people who aren't legally in the country. Now, I'm pointing to these examples as places where the funding can be pulled from. If the state has a multi-billion-dollar budget surplus, then it has the funds available there to be able to pay for access to tests. I have long been critical of the Excluded Workers Fund that was created earlier this year. I don't believe the state should have passed it. I don't believe that the state should be replenishing it. And it's because, first and foremost, that funding in that pot should go towards other causes with a higher priority placed. To highlight the last part of your question as far as what to be doing differently, earlier during my remarks, I answered that in many respects. Just to highlight, I believe that's important to have consistent testing hours across the state. I pointed how in central New York, the testing is available for 4 days a week for 6 hours. But in the Finger Lakes, the testing is available 6 days a week for 9 hours. I believe that the testing hours should be consistent from one region to the next. The second thing that I advocated for earlier on during this press conference is expanding the testing hours. I referenced that Central New York example where the test site is open for 4 days a week for 6 hours a day. 3 of those days are during prime business hours. We just need more hours available. I also discussed earlier the healthcare workers who have been fired for not having received the COVID vaccine. I believe that we need these medical professionals through their use of PPE, as well as being able to test negative prior to their shift. There's an ability to directly deal with the staffing shortage by allowing these men and women to be able to go back into the workforce, especially after we read these reports of testing sites being closed down due to a staffing shortage. I would also reference, another example is expanding subway testing to other cities. Governor Hochul announced that the MTA would be offering COVID testing sites at subway stations. I think it would be wise to ensure that other public transportation systems in other cities in the state, including places such as Buffalo, Rochester, Syracuse, and/or Albany, can also have similar options. And as I referenced at the beginning of this answer, being able to acquire more testing materials through the use of the budget surplus. I also would point to some of the great examples brought up by some of the other speakers on this call of particular testing sites that need to be open. You heard Assemblyman Schmidt, for example, reference a site in the Hudson Valley that he believes should be open. You heard Senator Oberacker talking about the need to be providing additional resources to counties. This has been consistent throughout the entire COVID pandemic, is getting feedback from local governments, from local hospitals, that they have ideas, they have the plans, they've rehearsed how to deal with these issues. They know how to most efficiently and effectively deal with getting PPE out throughout a community. We heard that earlier on in the pandemic. Fast forward to today, we're hearing it as far as their ideas, their resources, their efficiency in being able to distribute tests. So many of the speakers here today offered their ideas as well as what we could be doing differently. And I'll yield back to Katie from my team to see whether or not we have any additional questions from the media.
Sure. Ashley
Go ahead.
just has one follow-up. If New York were to limit access to testing sites kits only to legal citizens, which you seem to suggest in the beginning when referencing the billions of dollars going towards services for the undocumented, how would that help stem the pandemic, since those people would only continue to spread the virus?
Well, I was speaking specifically to the Excluded Workers Fund. That is something different than the testing. And thank you for the follow-up question, but I'm speaking specifically to one of the pots of money that exists here in New York State, the Excluded Workers Fund. But that wasn't specific to testing. It was related to that payment that is made for people who are not working, who are not in the state and country legally. But thank you for the question, but that fund wasn't related to testing specifically. Katie?
Our next question is from Carl from the New York Post. Carl, your line is open.
Greetings, Congressman. How are you?
Great, Carl. Good morning.
Hey, I just want to run some figures by you. Yesterday, figures released yesterday, so it would have been for Tuesday, that had New York State tested 362,594 residents. If the average nationally was about 1.8 million. So that's about close to 20% of the tests are being done in New York State. So it's not like people aren't being tested. And so that would be like 2% of the population being tested in one day, actually. So can you comment on that? It's not, I mean, I don't, it's a question of, or people, it's just panic going on with people trying to get tested at one time, or, you know, what do you see as the problem here? It's not that people aren't being tested. Can you comment on that? I mean, 362,000 people being tested in one day. That's a lot of people being tested.
Thank you, Carl. Now, the good news is that you have a lot of people who are experiencing milder reactions than what we've experienced during past surges, past variants. That is good news. This isn't a time for people to be freaking out over this new variant. If you are somebody who is more at risk, if you have comorbidities, you're at an older age, there are certain New Yorkers who are experiencing more severe reactions than others. Also, while the Omicron variant is spreading quite a bit here in New York right now, it's not the only variant. We're also hearing reports of people who are also testing positive, who are coming in contact with the Delta variant. But what is very important is if you are a part of a population that is at a higher risk, that's something that might impact your decisions day to day, more so than somebody who is possibly younger, healthier, no comorbidities. Fortunately, there are a whole lot of people who are going out and they are getting themselves tested. Fortunately, their reactions generally are milder. So what happens if it becomes difficult to access a test is that there are people who are just deciding not to get tested. There are people who want to get tested, but if they have to wait 4 hours to get a test, if they are going into a walk-in clinic and finding out that they can't go get that test at that clinic, they show up somewhere else and it's closed due to a lack of supply, due to the amount of people who have come in, so they filled up the schedule for the day, due to staffing shortages. What we're hearing all across the state, and I'm hearing as well personally, is that there are a lot of people who are not getting tested, and they are citing these specific examples that I referenced earlier in my remarks as their reasons for their frustrations. They have cited longer wait times. They've cited canceled appointments. They've expressed not just their confusion, but also the confusion of those staffing sites that are running out of tests and other clinics that are closing down for other reasons. We have in New York a massive surge, a massive spread right now of people who are testing positive. And unfortunately, there are some very real issues with how this is being administered in the state, which is the reason why we're all here today, is to address that and to provide ideas to Governor Hochul and the state as to what they can be doing better. Again, having consistent hours around the state, having expanded hours at sites to acquire more testing. They're contracting through a company, and if that company is not providing enough supply, then they should be seeking out additional contracts from others. Additionally, this isn't some hindsight is 2020 situation, because so much of this was foreseeable. This chaos that's taking place at this particular moment in time has other impacts to health of New Yorkers. And where you see a staffing shortage crisis made worse because an unvaccinated worker is not allowed to be able to provide their healthcare expertise. When PPE is available, when testing options are available, we're seeing impacts elsewhere. New York State has suspended at many hospitals the non-elective surgeries, non-elective procedures. And when people have a necessary medical attention that needs to be focused on by providers, when you punt that type of care, that type of treatment, you can see those issues end up getting far worse as you get further along in the progression of whatever might be diagnosed early, because early detection is critical with regards to medical treatment. So yes, people around New York and this state in this country have been able to access tests, but the amount of progress that is available, the amount of efficiencies and opportunities that are before us today to make this all operate much smoother. Unfortunately, it's filled with not just massively missed opportunities, but also in many respects, utter incompetency. Now, if you're in government, my last point is, you have an opportunity to prioritize your focus. If you're the governor of the state of New York, it's important to focus more on ideas, on solutions, having expanded access to testing to make sure these sites are run well, that the workers are there to staff them, that the tests are available at the sites, that New Yorkers have less confusion, less frustration, less anger because the state is doing a better job. It's a good place to focus your attention. Assemblyman Schmidt earlier was talking about access to treatment, access to therapeutics. There's a federal government role as far as the research for further advancement. And I appreciate these other speakers in sharing their ideas. But Carl, thank you for being on the line and asking your question. But there are just so many different ways for New York State to do this so much better. And that's why it was important for us to come to this call today. This isn't just about being critical of Governor Hochul and her administration, which there's many reasons why New Yorkers are very angry at the state and the federal government, but also coming to this call today with all sorts of different ideas of ways to better address this issue instantly. This isn't something for us to have this, press conference 6 weeks from now and say, these are the ideas that should have been implemented on December 30th. We're here this morning on this call, sharing these ideas on December 30th. And hopefully the state can heed our advice, the federal government can heed our advice, and we'd be able to move forward. So thank you so much, all the media. We don't see any other questions, but we had the questions from WAMC, the questions from Carl Campanelli. And I actually, Katie, I believe that Carl might have a follow-up question.
Carl, your line is open.
Hey, Congressman, just a follow-up. When you mentioned earlier that you want uniform hours for the testing sites, are you just referring to the testing sites that are run by the state government, or is that all testing facilities run by whether it's the local governments or the private outfits? Because there's been a lot of complaints about Albany sort of dictating, what's being done, and that the locals sort of want more, more control and flexibility on how to handle this. So when you say that you would have, as you were governor, that you require uniform hours, would that be an order through your state health department or through the governor's executive order, that all testing facilities across the state, whether run by the state government itself or local governments, that would be a requirement that you would impose or put in place, make it a mandate?
Carl, thank you for the follow-up question. And I'm just referring to state testing sites.
Thank you.
Well, thank you all for participating. Thank you to our Republican leader, Rob Ortt, in the New York State Senate. Thank you to New York City Councilman Joe Borelli. We also had New York State Senator Peter Oberacker on the call, Assemblyman Colin Schmidt, Assemblywoman Jody Giglio, Assemblyman Jarrett Gandolfo. If any